administering oxygen therapy via nasal cannula and face mask.
So, good afternoon. I'm Jamie Bervano and I will be presenting the assessment of administering the oxygen therapy. So, before starting, you will introduce yourself to your patient. So, I am Jamie Bervano, your student nurse for today, ma'am. So, before getting the personal data, of course, you need to know the citizen of your patient and you need to know the language of her, of course. So, ma'am, are you Filipino?
Yes, po.
After asking the client of her citizen, of course, you need to ask what is her language. So, what is your language?
Tagalog.
Tagalog. So, before starting the personal data or before getting the personal data, you need to explain that, ma'am, your personal data will remain confidential. So, of course, I will get your name. Ano pong pangalan niya, ma'am? Ilang taon po?
21.
Taga saan po?
Pampanga po.
Ano po kayo, working or student? That's why we need to know the citizen and the language of our patient in order for them to cooperate properly and be comfortable as well. For the assessment, you need to determine the client history including the acute and chronic health problems. So the rationale for that is that clients with carbon dioxide retaining the chronic obstructive pulmonary disease, which is COPD, will need lower amounts of oxygen. So as not to obliterate their hypoxic respiratory drive, they may already have oxygen which they need long-term therapy. So, I will ask you, ma'am, nagkaroon na po ba kayo ng asthma before? Okay. So, after that, after knowing the history of the patient, the next thing you will do is to assess the client's baseline or the patient's baseline respiratory sign, including the airway, the respiratory pattern, the rate, the depth, and the rhythm. So, you need to note if there is any indication or abnormalities in your assessment. So, the rationale for that, it helps to determine the client's need for oxygen as well as response to the therapy. So, ma'am, can you say ah? Okay. So, I didn't see any unusual. Then, after that, I will check the respiratory assessment. When it comes to respiratory assessment, I will ask the patient to do normal breathing. So, ma'am, normal breathing po ay hinga lang po kayo ng normal, tapos tingin po kayo dun para hindi po kayo ma-conscious. I will just use my wristwatch in order to know if she is in a normal range when it comes to breathing. So, yun po kayo. Normal lang. Okay. So, after that, the respiratory depth and rhythm will be instructing to do the normal inhalation, exhalation, including the forceful inhalation and exhalation. So, ma'am, inhale, inhale, exhale, exhale. Okay. So, based on my observation, there is no increased work for bleeding. So, next is respiratory breathing. For the chest auscultation, so I will use my
I adjust the speed in order to shorten the video because I'm just doing the chest auscultation there.
So, based on my chest auscultation, so, the assessment of the chest auscultation, as I have heard, there is no abnormal sounds of abnormality when it comes to her breathing. So, next is I'm going to check the extremities and mucous membranes closely to the collar. So, why do we need to check the extremities of the patient? It is because to ensure that the need of oxygen administration. So, ma'am, patingin po ng inyong kamay. Okay. Kabila po. Okay. Tayo po kayo, ma'am. Okay, so thank you po, ma'am. After checking the color of the skin of the patient or the mucous membranes, the next thing that you need to assess is the ABG, which is the viewing of arterial blood gas and the pulse oximetry results. So, the rationale for that, these are the most important determinants of the effectiveness of the pulmonary system. So, they also need to support the performance and the procedure to determine the changes in the therapy. So after that, we need to get the arterial blood gas, as I've said earlier. So I don't have pulse oximeter, but I will just show or instruct my patient how she can cooperate properly. So when it comes to ABG or pulse oximetry checking, the first thing you need to do is make sure that the patient doesn't have nail polish. So ma'am, patingin nga po kung may cutics kayo. Okay? Wala. So, the next thing you need to do is the hand temperature. So, ma'am, pahawak po ng inyong kamay. Okay? So, next is, you need to rest the body or the patient need to relax her body in order to place the pulse oximeter in the middle finger. So, place the other hand on the near of the heart and minimize hand movement in order to get the proper value of the oxygen. So, ma'am, relax lang po kayo. And yung pulse oximeter po ay papasok ko sa middle finger. And then, yung isang kamay niyo po ay i-place niyo sa may heart niyo. Okay. After that, you need to record the highest reading that flashes in the pulse oximeter, which establish 5 seconds and tell them the purpose of pulse oximeter. Okay. So, I will explain the purpose of pulse oximeter. So, ang pinaka-role po ng pulse oximeter ay para malaman natin ang amount ng oxygen sa ating dugo. At ang normal po na oxygen sa ating dugo ay 95 to 100. Tapos, kapag tumaas pa po yun or bumaba, ay alarming na po ito para sa isang tao. Next for the assessment ay lung sounds. So, what is lung sounds? It is in order to know the wheezes and the crackles. So, the rationale for that, ma'am, it is the secretions that will interfere with airway patency and diffusion of oxygen, and also including the carbon dioxide across the alveolar capillary membrane. Next is you need to assess the nostrils, back of earlobes, cheeks, and the tracheostomy site, mouth or areas of oxygen and that constant contact with the skin. Then, the rationale for that is in order to make sure that is safe for oxygen administration. So, I will just check your earlobes, ma'am. So, ang likod ng inyong tenga. Okay. Hila po. Okay. Cheeks niyo po. Okay, ang
I checked the nostrils, but I forgot to tell it right away.
And then, nga po kayo. Okay. So, next is for the planning phase. The first thing you need to do is to verify the physician's order for oxygen therapy. What is the rationale for that? It is in order to determine the need of the patient. You need to perform this procedure but except in emergency situations because the oxygen should be regarded as a drug that should be given with prescription according to the BTS National Guidelines 2008 and also the British National Formulary 2010. Then, also, you need to check the patient's room. Whenever possible, you need to replace the electrical devices with non-electrical ones. Then, you should also post the no smoking sign in the patient's room in order to make sure that is safe for oxygen administration. So, for the generalized materials or sa general materials, we need to prepare the materials that needed for the procedure. Of course, the oxygen source with flow meter and adapter, the oxygen tubing, the humidifier with distilled water according to the agency protocol. So, what is the rationale for preparing the procedure or the materials that needed? It is organized materials which equipment that should save time and energy, so it facilitates the accessibility during performance of the procedure. So another that needed is nasal cannula. So the nasal cannula that needed the hypoallergenic tape but as needed. Then for the face mask, I have here only the simple face mask. But for the simple face mask or the face mask, it is prescribed in appropriate size. So before proceeding to the implementation, you need to do the hand washing first and also do the Dawn gloves. What is the rationale for that? It is to deter the spread of microorganisms and to avoid contamination from patient secretions. So I will wash my hands and I will be back. So after
The alcohol
washing your
that I
hands,
use
of
is
course,
ethyl
I will use
alcohol
my
in
alcohol
70%.
here. And I will do the Dawn gloves.
I adjust the speed of this clip it is because to lessen the time of the video.
So I have here already my gloves, and I will explain the procedure to the patient or to the significant others. So what is the rationale for that? It is in order to alleviate the anxiety and gain cooperation of the patient. So you need to attach the flow meter to wall, outlet, or tank. So the flow meter should be in off position. So what is the rationale for that? It is in order to regulate the flow rate according to the doctor's order. So you need to avoid the accidental escape of oxygen from the source. So next is attach the humidifier to the base of the flow meter. So you need to fill the humidifier bottle with distilled water. So the rationale for that, it is the oxygen forced through a water reservoir or humidified before it delivered to the patient. So it will prevent dehydration of mucous membrane. So as I said earlier, it should be in a off position. But I use this one because this is just a improvised of humidifier and also the oxygen tank. So next is I will attach the prescribed oxygen device to the oxygen tubing. You need to attach the oxygen source through the humidifier. So what is the rationale for that? It is in order to access the oxygen source. So I have here the actual of nasal cannula. So you need to set the appropriate size according to the physician's order. So what is the appropriate size or appropriate flow rate of the nasal cannula? It is 2 to 6 liters per minute. What is the rationale of knowing the flow rate of the nasal cannula? It is to facilitate the effective delivery of oxygen according to the device ordered. So it should be rated above 6 liters per minute. So it is not efficacious that can dry nasal mucosa. So after that, you need to facilitate the effective delivery of oxygen according to the device ordered. I will go and attach this one to the humidifier. After connecting the nasal cannula to the humidifier, you need to check the oxygen flowing freely through the tubing. So there should be no kinks in order the connection should be airtight. Then what is the rationale for that? You need to avoid escape oxygen through the tubing in order to facilitate proper flow of oxygen through the tubing of the patient. So you can see here if there is any bubbles also as the oxygen flows through. So what is the rationale? It ensures the equipment if it is functioning well. So as I've seen, there is no bubbles because this is a nasal cannula that you need to connect to the patient as well. So you need to fill the oxygen at the outlets of the prescribed oxygen device. Then next is you're going to apply the appropriate oxygen delivery device to the patient. So the rationale for that, it is to start the administration of the oxygen therapy. So of course, the nasal cannula, you need to place the nasal prong in the patient's nostril, which is this one. Then you need to secure the cannula in place by adjusting the tubing around the client's ears and using the slip ring, which is this one, in order to stabilize it under the client's chin. So if the cannula will not stay in place, tape the side of the face. So what is the rationale? It is to keep the delivery system in place so the patient receives the oxygen ordered. So I will place this one here. So after attaching the nasal cannula to the patient, you need to ask if the patient is comfortable or not irritated when it comes to the nasal cannula. So ma'am, hindi po ba kayo irritable sa nasal cannula? Okay lang po kayo? Okay, so thank you. So after administering the nasal cannula, so of course the next one is administering the face mask and face tent. So what is the first step that you need to remember? You need to guide the mask toward the patient's face end, apply it from nose downward. So what is the rationale for that? It is to ensure proper placement of the device. So you need to fit the mask contours of the patient's face. What is the rationale for that? It is in order to know the mask should mold into the face, so that the very little oxygen escapes into the eyes and cheeks, also the chin. So next is you need to secure the client's band around the patient's head so that the mask is comfortable but not snug. So the rationale for that, it is in order the patient is more likely to comply with the therapy, so if equipment fits comfortably. So I will place this one. Into the humidifier. So I will place this one to the humidifier. So I have only the simple face mask, not the non-breather mask. So I have here the simple face mask, and I will connect it here. So after connecting the tubing, you need to connect it to the patient. So ma'am, may I put it in your... So of course, also you need to ask if the patient is comfortably to the face tent and face mask. So ma'am, komportable po ba kayo? Okay lang po ba? Hindi po ba masikip? Okay. So, the next thing is, or for the additional in the nasal cannula procedure, you need to assess the patient's nostril every 8 hours. So, if the patient complains of dryness or has signs of irritation, you need to use the lubricant to keep mucous membranes moist. So, of course, you need to add water into the humidifier according to the indicated level. So, what is the rationale? It is to dry the membranes are more prone to break down by friction or pressure from the nasal cannula. Then, for the first assessing in the face mask and face tent, you need to assess the face and ears of the dampness, irritation, chafing, dryness from the mask. Treat it as needed. So, what is the rationale? It is in order to treat skin irritation that may develop from the therapy and to prevent further complications. So next is you're going to observe if there is gagging, retching, nausea, or vomiting. So you need to remove the mask if any of this occurs. So the rationale for that, this may cause feeling of suffocation or suffocating, and that patient needs frequent attention, so you need to monitor and reassurance. So next is you're going to regularly check for a level of water and humidifier. You need to fill or refilled with water as needed. So the rationale for that, it is to provide continuous humidification and prevent dryness of mucous membranes. Then next is you need to wean the patients from oxygen as soon as possible using the standard protocols. So the reason for that, it is in order to prevent the patient becoming dependent within the therapy. Then after that, you need to dispose all waste materials properly and to avoid the risk of contamination from microorganisms. Example for this is the gloves. You need to dispose it properly. So last is the evaluation. So first thing you need to do when it comes to evaluation first is assess the patient's vital signs, level of anxiety, color, ease of respirations, and provide the support while the patient adjusts to the device. The rationale for that, it is in order to detect and address any untoward response from the therapy. So, of course, the next one is you need to assess the patient regularly for clinical signs of hypoxia, tachycardia, confusion, dyspnea, restlessness, and also the cyanosis. So, I will do first the patient vital signs. Vital signs. So, the patient vital signs is 120/80, so that is in a normal rate. So, after getting the vital signs of the patient, of course, the respiratory rate that you will need to get. So, ma'am, katulad lang po na ginawa natin kanina, hinga lang, upo po muna kayo. Sige. Upo muna kayo. Yan. So, ang gagawin natin, hinihilan ko yung normal, para normal natin yung respiratory rate. Kung may babang, wala. Okay? So, ma'am, nakayo normal. So, after getting the respiratory rate of the patient, you need to monitor the patient's oxygen saturation, including her ABG 20 minutes after initiating the therapy as ordered by the physician. So, the rationale for that, it is in order to evaluate effectiveness of the therapy. So, lastly, you need to document the procedure and response of the patients to the therapy. And for the reason that you have recorded data for continuity of care, it is because you are liable to that patient if ever might happen or an emergency happen.